Hello everyone, I am Vijay Yadav, PhD student at Institute of Chemical Technology, Mumbai. I am working with Dr. Prajakta Dandekar Jain on developing nano-based material for application of diagnostic kit. Diabetes is widespread across the globe. According to survey of WHO, 347 million people having diabetes, and it is predicted that 366 million people will be having diabetes by 2030, with maximum patient in India. Current detection method for diabetic patient are enzyme based technology, which uses glucose oxidase as a detecting agent, and it is an invasive technique which requires bloods. Due to invasive technique, patient feel undesirable and uncomfortable. So the inherent cost of enzyme technology limit the use of enzyme based technology for the better control of glucose monitoring. Our research group has developed a non-enzymatic material which can sense glucose in any biological fluid such as saliva, urine and blood. Being a non-enzymatic material, the cost will ultimately low, and being a non-invasive, it is patient friendly. This novel technology can be converted into various diagnostic tools from which many diabetic patients will get benefited across the globe. Considering the lowering the cost of this diagnostic kit, many diabetic people will monitor and control their glucose level more frequently. Now I will demonstrate the glucose detection methods. Let us take the 1 ml of this standard glucose solution. The first 3 glucose standard solution represent the saliva concentration, and other 4 represent the glucose concentration of blood and urine. Let take 2 concentration from this standard glucose solution. We are taking 500 microgram per ml and 4000 microgram per ml. Now let us add 1 ml of each glucose solution in this vial. After the addition of the standard glucose solution, I am going to add 500 microliters of catalyst which we have developed in our lab, which can sense the glucose level even in femtogram levels. Now we have added 500 microliter of the catalyst. Now the next step, we have to add the accelerator which initiate the reaction. Now let us observe the color of these 2 solutions. Observe the color that the first vial show the less intensity than the other. So from this we can identify whether the patient is diabetic or non-diabetic. Now this technology can be converted into strip-based technology. To check the strip-based technology, we are taking same concentration as before, 500 microgram per ml and 4000 microgram per ml. From this, I am taking 1 drop of this solution. Now I am adding 1 drop of catalyst solution which will oxidize the glucose. Now I am adding 1 drop acetate solution, which will give the color intensity to the strip. Now we can clearly see that the two different spots has developed due to difference in the concentration of the glucose. So we can clearly differentiate that the high glucose concentration and low glucose concentration from urine or blood sample or saliva.